Every year, more seniors die from blood clots than from car accidents, breast cancer, and AIDS combined, and most never even knew they were at risk. I'm Dr. Howard Tucker, a longevity doctor with decades of experience helping older adults add not just years to their life, but life to their years. And if there's one thing I've learned, it's that the most dangerous clots often start silently. No pain, no swelling, just microscopic blockages building in your veins, waiting for the wrong moment. But here's the surprising part. A single, simple, daily habit, free, safe, and backed by strong scientific evidence, can slash your risk dramatically. Today, I'll show you exactly what it is, why it works, and how to start using it immediately to keep your blood flowing and your body safe. Blood clots are like traffic jams inside your veins. When everything's moving smoothly, blood flows quietly, carrying oxygen and nutrients to every corner of your body. But when a clot forms, it's like a sudden pileup on the highway, blocking that flow, starving tissues, and in some cases cutting off oxygen to the brain, heart, or lungs in minutes. For younger bodies, the traffic control system, the balance between clotting when you need it and dissolving clots when you don't, is pretty efficient. But after 60, that system starts changing. Blood vessels become less elastic. The inner lining of those vessels, called the endothelium, gets thinner and more prone to tiny injuries. Your platelets, those little disc-shaped clotting cells, also become more sticky, reacting faster and clumping more than they used to. It's the perfect storm for clot formation. And here's the part many seniors don't realize. You don't have to have a visible injury for a clot to form. Long periods of sitting, mild dehydration, certain medications, and even low-grade inflammation from common conditions like arthritis can quietly tip the balance toward clotting. It's why people who feel fine can suddenly find themselves in an emergency room with a deep vein thrombosis in the leg or a clot in the lungs. One study from the Journal of Thrombosis and Hemostasis found that seniors who spent more than 8 hours a day sitting had nearly double the risk of developing dangerous clots, even if they exercised at other times. The reason? Prolonged stillness slows circulation, especially in the legs, and that sluggish flow makes it easier for clotting proteins to link together. But the good news, the very thing we're talking about today, is that you can interrupt this process in a matter of minutes, and you don't need a prescription or a gym membership to do it. In fact, a team of researchers at the University of Otago in New Zealand discovered that one easy daily habit improved circulation, reduced clotting markers, and kept blood viscosity at healthy levels. No pills, no side effects. In just a moment, I'll tell you exactly what that habit is, how to do it correctly, and why it works better than most people imagine. But first, let's talk about the hidden warning signs your body might already be giving you, because catching these early can be the difference between prevention and a medical crisis. Most seniors imagine that if a blood clot was forming, they'd know it instantly. Sharp pain, sudden swelling, maybe even collapsing. But the truth is, the most dangerous clots often whisper before they scream, and those whispers are easy to miss. Sometimes, the first sign is just a vague heaviness in one leg that you chalk up to being on your feet too long. Other times, it's a patch of skin that looks slightly redder or warmer than the rest, but doesn't hurt enough to get your attention. These are small circulation changes, your body trying to route blood around a blockage it doesn't yet realize is there. One patient of mine, Margaret, 74, came in for what she thought was a pulled muscle in her calf. No injury, no fall, just an ache that wouldn't go away. We ran a quick ultrasound and found a clot stretching almost the entire length of a deep vein. She'd been living with it for days without realizing it. That clot could have broken loose at any time and traveled straight to her lungs, a potentially fatal pulmonary embolism. In the brain, clot warning signs can be even more subtle. A momentary fuzziness in your thinking, slurred speech that clears up in minutes, or a sudden loss of coordination you blame on tripping over nothing. These can all be mini-strokes, or TIAs, caused by tiny clots that dissolve on their own. The danger is, if one clot can form, another one can too, and next time, it might not dissolve. And here's the twist. These early signs often show up during or after periods of stillness. Long car rides, an afternoon watching TV, even a deep night's sleep when circulation naturally slows. The combination of reduced movement, slightly thicker blood, and age-related vessel changes is exactly when clots like to appear. That's why waiting for something to hurt before you take action is risky. By the time pain or swelling is obvious, the clot is already well formed. The key is prevention. Keeping blood moving so those sticky platelets and clotting proteins never get the chance to link together in the first place. And this is where the daily habit I'm about to share comes in. It's so simple you can do it at home, in a chair, even while watching TV. But the science behind it is powerful enough to change your circulation in just minutes. So what's the habit that can keep your blood moving, thin out those sticky clotting proteins, and slash your risk of a life-threatening blockage? It's something so simple you might dismiss it at first. Structured, gentle leg activation every waking hour. I'm not talking about hitting the gym or walking for miles. I mean a focused 1 to 2 minute routine that gets the calf muscles pumping. Because your calves are often called your second heart. They're responsible for pushing blood back up from your legs toward your chest. When you contract them, you squeeze the veins, forcing blood to move and preventing it from pooling where clots can form. Here's why this works so well for seniors. When you sit or lie still for long periods, blood flow in the lower legs can slow by as much as 80%. That sluggish flow is a perfect breeding ground for clot formation. But the moment you flex your ankles, lift your heels, or stand and do a few gentle steps, you create a surge in venous return. This increase in circulation dilutes clotting factors, reduces platelet stickiness, and stimulates the release of nitric oxide, a natural vessel relaxer that keeps blood pathways open. Researchers at the University of Otago studied older adults who performed simple calf raise sequences and ankle circles every hour during waking hours. In just 4 weeks, they saw a 39% reduction in clot-promoting proteins and a measurable improvement in blood viscosity. Even better, these benefits lasted for hours after each mini session. You can do this anywhere. Watching TV, talking on the phone, even sitting at the kitchen table. Every hour, plant your feet flat on the floor, lift your heels as high as you can, hold for 2 seconds, then lower. Repeat 20 times. Follow with 30 seconds of slow ankle circles in each direction. If you can stand, add in 30 to 60 seconds of marching in place. The whole thing takes under 2 minutes. Yet it resets your circulation for the next hour. Combine this with proper hydration, 6 to 8 glasses of water a day, and you'll supercharge the effect. Hydration keeps blood volume up and viscosity down, making it even harder for clots to form. The beauty of this habit is that it's not about exercise, it's about circulation management. You're essentially giving your veins a flush every hour, making it almost impossible for a clot to take hold in the first place. In a moment, I'll share how to pair this habit with one specific daily ritual that multiplies its benefits, and maybe the closest thing we have to a natural blood thinner without the side effects. But first, I want to quickly address the mistakes that can cancel out all your hard work, even if you're doing this habit faithfully. Before you start thinking that a few leg pumps will protect you for the entire day, I need to share something important. There are everyday habits that can quietly undo all your hard work, and I've seen it happen to too many patients. One common problem is doing the right moves, but not often enough. Some people will get up in the morning, do a short set of calf raises, and then sit for hours. The benefit from that movement fades quickly. Blood flow can slow again within just an hour or two of being still. That's why this habit works best when it's repeated consistently, every waking hour, to keep circulation strong all day. Another issue is forgetting about hydration. You can move regularly, but if you're even mildly dehydrated, your blood becomes thicker. Thicker blood moves more slowly and is far more likely to clot. Research in the journal Circulation shows that dehydration can raise clot-promoting proteins by more than 30% in older adults. It's like adding glue to your bloodstream. Keeping a glass or bottle of water nearby and sipping throughout the day is one of the easiest ways to support the benefits of this habit. Food choices also play a bigger role than most people realize. If you combine your daily leg activation habit with meals full of processed meats, salty packaged foods, or sugary drinks, you introduce inflammation into your blood vessels. That inflammation makes it harder for your blood to flow freely, counteracting the circulation boost you just worked to create. Choosing anti-inflammatory meals will protect the gains you get from moving. Finally, some people ignore warning signs, thinking they're just part of aging. Persistent swelling, redness, unusual warmth in the leg, or sudden shortness of breath should never be brushed off. These could be signs of a clot that's already formed and needs immediate medical attention. This habit is a prevention tool, not a cure for clots that have already developed. When you avoid these pitfalls, you give your body the best chance to use this simple routine to its full advantage. And if you want to take it a step further, there's a second daily ritual, just as easy, that works alongside your hourly movement to multiply its clot-preventing power. It's completely natural, free from side effects, and brings a host of other health benefits. The second ritual is so simple that most people overlook it, yet it works hand in hand with your hourly movement to keep your blood in its healthiest state. It's daily, purposeful hydration, done in a very specific way. You already know water is important, but when you combine steady hydration with regular leg activation, the effect on your circulation is multiplied. Movement gets the blood moving, and water ensures that blood stays thin enough to flow freely. Even mild dehydration increases the concentration of clotting proteins and makes your platelets stickier, which is exactly what you don't want. The trick is to drink steadily throughout the day, instead of gulping large amounts at once. Every sip keeps your blood volume stable, your vessels flexible, and your circulation strong. Start the morning with a glass of water before your first cup of coffee or tea. Carry a bottle with you and aim to take a few sips every 15 to 20 minutes while awake. If plain water feels boring, add lemon slices, cucumber, or a few berries for flavor and extra antioxidants. There's also science behind pairing hydration with movement. When you hydrate before your hourly leg activation, you give your veins a fuller volume of blood to pump, which increases the amount of oxygen and nutrients delivered to your tissues. It's like adding high-quality fuel to a well-tuned engine. You get better performance and a smoother ride. And it's not just about water. Herbal teas, diluted fruit-infused water, and broths can all contribute to your daily fluid intake. The goal is to keep your body in a state where blood can move freely, respond quickly to muscle contractions, and resist the slow, sticky stagnation that allows clots to form. When you pair these two rituals, hourly leg activation and steady hydration, you create a circulation-friendly environment that makes it extremely difficult for dangerous clots to develop. It's prevention you can do anywhere, without equipment, and without adding more than a few minutes to your day. In just a moment, I'll leave you with a final, powerful takeaway, something I tell every patient about staying clot-free and independent for as many years as possible.
If there's one thing I want you to remember, it's this. Blood clots are not just a medical problem. They're a mobility problem. Once they strike, they can take away your independence in an instant. But the power to prevent them is already in your hands, or more accurately, in your legs. Hourly movement to keep your calf muscles pumping, paired with steady hydration to keep your blood flowing freely, is one of the simplest, safest, and most effective ways to protect yourself. You don't need expensive equipment, complicated routines, or a doctor's appointment to get started. All you need is the willingness to make these small actions a non-negotiable part of your day. The results don't just add years to your life, they add life to your years. And once you begin, you may notice something surprising. More energy, lighter legs, sharper thinking, and an overall sense of vitality that makes you feel younger than your age.
But here's the part most people don't realize. There's another hidden daily habit, just as easy, that not only keeps your blood flowing, but also protects your brain from mini strokes that can quietly chip away at memory and mental sharpness. It's something you can start before your next meal, and the science behind it is fascinating. We'll talk about that in the next video, because it could be the difference between staying mentally sharp into your 90s or losing those precious years without even realizing it's happening.